We have Shayne with Therazona Physical Therapy. We're starting our mobility clinic on hips and low back. I'll let Shayne take the show. Yep.
Awesome.
How long have you been doing physical therapy?
Oh man, over 20 years.
Yep.
Yeah.
So lots of experience.
It looks it too, I'm sure. But it's really good to be here. I started in Prescott for about 16 years and then moved here to Gilbert. My daughter and I own the Therazona Physical Therapy Clinic, and so we've been here for almost 4 years, and we love CrossFit. We've been over here a number of times, especially pre-COVID days. Yep. We were over here doing mobility WODs / classes for months and months, and we did a lot of different types of ones, whether it be on neck or hips or back. We did some on foot and ankle as well, and shoulders especially. So we've done a little bit of everything. So we're glad to be here and glad to kind of partner up with you guys.
Yep.
Yeah.
Shayne and I also go on lots of adventures now. So we did rim to rim to rim at the Grand Canyon back in October. It was a 48-mile day. And so I know that what Shayne teaches works because it's working for both of us. And it's awesome what we're able to keep doing.
Keep doing it. Awesome. So today we're going to talk a little bit about the back and the hip, right? So that's kind of what our message is. And I know that we see some patients in Therazona from CrossFit with a number of different injuries, right, and conditions as it relates to hips and back. So I think Chris is like, hey, it's time to do a mobility course. What do you want to do it on? I'm like, I think we just need to get back to the basics, which really just start right in here. So we'll talk about core, hips, low back a little bit, and talk a little bit about why we have injuries and conditions as a result of maybe not doing mobility and stretching and things like that are kind of what we use for recovery day, so to speak, or we do after exercise, which usually gets swept under the rug. Just talking to Richard here, he's just like, yeah, I've been doing CrossFit, but the mobility part of it is like difficult to fit into your routine, right? So it's something that takes a little bit of discipline, but as you get older, it becomes a little more of a priority. I've noticed when I was in my 20s and 30s, it wasn't too much of an issue, but as I've gotten older, definitely bouncing back, being resilient, getting your muscles in tune, stretched out, ready for the next race and or training session is harder and harder. So mobility becomes a big part of that. Okay, so let's talk a little bit about the back and the hips real quick. In CrossFit especially, we see exercises that you guys do in this plane of motion, which is a sagittal plane. Okay, this is the frontal plane, things like this. If I'm laterally moving, you guys do a lot of stuff laterally, not as much as you do here, right? Any kind of Olympic lifts, whatever, those are all in this plane of motion. So not a lot of lateral stuff, but you do lateral jump overs or lateral burpees, or you might do lunges or running especially. You don't think of as a lateral thing, but you do actually go onto one foot at a time, and as you do that, your body's moving laterally, unless you're super stable in your hips, right? So we're gonna talk a little bit about that as well, but for the most part, CrossFit, you're gonna be tight here in these hip flexors, right? Why? Because toes to bar, knees to bar. I saw that was on the program today, right? So these muscles here, the hip flexors, are constantly being used. Then you go home, sit down, get on the computer. So are they getting stretched out? Nah, not a whole lot. So you're using them, right? Then you sit and you just here, and then these things get all bound up and tight. And then you go to stand up and go, oh man. So that plays a role. The other part of it is extension. We were just talking a little bit about anything goes overhead, my back's kind of going into extension. If I have a shoulder issue and my range of motion is only to here, where can I put the bar? How do I move or adjust my body in order to get the bar overhead? Right? So I extend my back in order to get the bar here because my shoulders only take me to here, right? So I end up arching to get that overhead. So anything that we do overhead also gets a lot of load with extension. Also think of back squats too, right? You're here and we're here, and sometimes we're not tightening our core and finding neutral spine when we're doing our exercises, especially those things that we're putting on our back. So we need to watch our form, and the coaches are here to kind of watch that. They do a great job of saying, hey, or overextended, or I can see, you need to do this or that. Don't go as low, or think about this, think about bracing this way. So they're giving you tips along the way, but I think overextending is a big problem. Deadlifting, same thing. Deadlifting, sometimes it's a part of our hamstrings. Maybe our hamstrings are too tight, and we're grabbing the bar like this instead of like this, right? So the mechanics plays a big role of it as well. So we're going to talk about how can we keep neutral spine. The only way we can do that is to keep the hips more mobile. So that's what we're going to talk quite a bit about, is just kind of how do we keep these hips as mobile as we can. The last thing is the lateral movement is a big part of mobility. And so we're going to incorporate some things that we can do to kind of stretch out the lateral side of our hips. We see in physical therapy a lot of IT band syndromes or sciatic issues, both of which come by way of some lateral movement, muscles that are being overworked and contracted but not stretched out like they need to be. Running as well causes a lot of IT band, glute medius, lateral hip problems, and so using the foam roller, lacrosse ball, things like that also will kind of help tease out that tissue, reduce the hot spots and trigger points, allow the muscle to function better. Does that make sense? So that's a lot of stuff, right? Real quick, I just want to go through, like, when you go and run, I get a lot of people who come in with hip issues from running. And you don't do a lot of running, but you do some running. And some of that running causes an issue, especially for those that haven't been running much. But if you think about it, when you're on one foot like this, if I don't have the strength from my hip to keep my hips neutral, every time my foot hits, I'm going to go into this position. What happens then? I lengthen this tissue, it gets overworked, right? So if I can strengthen my hip muscles, now all of a sudden my hips can stay stable, and I have a much better platform to work off of each time my foot hits the ground. And you don't think about that, but running, you're on one foot. Think of the not stairs, but step-ups that you do on the box, right? Same thing. Foot's really high, you're coming up, but there's a lot of torsion that is happening in the back as well. A lot of the torsional injuries we see are SI injuries. SI stands for sacroiliac. Sacrum is kind of the bottom part of the lumbar. Iliac is part of the pelvis. So it's the joint between the sacrum, the low back, and the hip. There's a little wedge that sits right in there. That wedge articulates when we move our knee up and down. So guess what? Lunges, right? Right? Or box step-ups, or running. All of that unilateral stuff, you get some shifting occurring in the low back, and that becomes irritable for the low back, especially the SI joint, and it causes some problems. So we're going to talk about what kind of remedies we can use: foam roller, mobility stick, rogue band, and lacrosse ball. All things that you guys have here that you guys can do either before or after. So you might say, well, when's the best time to use this stuff? I think post-exercise is the best time to use it. It's after the tissue has already been worked pretty hard, elevated temperature, the muscles are fatigued a little bit, tired, warm though, and very resilient and ready to be stretched and moved, right? So it's already in a good state. So that's when I would introduce the mobility part, is the last 10 minutes of your exercise. When you're done, lay down, grab the foam roller, grab a lacrosse ball, grab a rogue band, right? Those are all good ways to kind of tease out some of this stuff. But what do you do before? Warm up, right? So use the mobility stuff for mostly at the end of your session. In the beginning, a good warm-up is very important. Coaches do a great job of warming up you guys. Do this, do that, get the muscles that you're working during the exercise, those are the ones they're trying to warm up. They're trying to activate. They're trying to get that neural connection from the brain to the muscle, get that activated quickly, get those muscles pumping with blood so that when you start your exercise, that muscle's ready to go, right? So that's what is part of kind of a good warm-up. We'll talk about what can you do to warm up your hips and your back if you know it's going to be a heavy back and hip day. You're doing a lot of stuff. How can you prepare better? So we'll do that. So the first things I want to do is I'm going to kind of be out here. The first one I want to go over is everybody kind of spread out just a little bit, but stay on this side. right? Is that what you want to do?
What I can move.
Okay.
I'm adaptable.
So everybody get down on hands and knees. I'm going to take you through 3 or 4 different little hip mobility exercises that are great to kind of see how kind of the body's moving. First one is called cat-cow. You guys have heard of it probably before. Real simple, right? You arch your back nice and tall, and you sink in your spine in this fashion. Most of you, when you think about doing these, you're thinking about your back arching, right, this way, and then your back arching this way. But really what I'm most interested in is, look at my pelvis. Watch when it rotates forward in an anterior tilt, and then it goes back in a posterior tilt. So, as I'm doing a cat-cow, I'm actually rotating my pelvis forward and rotating my pelvis back. That opens up, gaps open kind of the low back spine. It decompresses some of that tissue that those discs are used to carrying. It opens it up, brings blood flow in and out of that tissue, allows for really good recovery. So let's do 10 of these cat-cows. Real nice and tall. And then sinking in. Do it nice and slow, that's 1. Work your way through 10 of these. Good. Focus on your hips. Think of your pelvis drawing up and in, and down and back. Arching, right? Up and in. Good. And then let it sink. Good. Then up and in and rotate those hips underneath you. Nice. Just like that. Really trying to pull those hips up and under. And then arching in the back. If you think about where your hips are going, the back's going to follow. And you're going to get a much better stretch that way rather than thinking about, oh, I got to arch my back and I got to sink my back, right? Think about your hips, where your hips are. Okay? So that's the first one. The next one I want you to do is bring that leg forward. Remember the Spider-Mans? You guys probably do that quite a bit over here. Bring leg forward like you're in a lunge. Lift up into that lunge so your back leg should be off the ground. Both hands planted on the floor. And what you're going to do is just a scour. You're going to do some oscillations. I want you to oscillate on that, whatever foot you have down right now. Oscillate clockwise 5 times. And then reverse directions 5 times. Good. I'm feeling that quite a bit. Chris and I went for a nice long, well, it's a 10-miler.
Almost 11.
And almost 11. My hips are so sore, so this feels so good up in my glutes. You can feel this nice and high. You might feel it on your hip flexor on your other side. You're scouring that hip. Try to make big circles and then go into small circles. And then get into big circles. The bigger you get, the more range you'll find in your hip. 5 that way, 5 counterclockwise. Good. Feel pretty good? Okay, next what we're going to do. Everybody with us? Open up as wide as you feel like you can safely, and also put your feet down the best you can. This is a frog position, okay? This is a tough stretch, especially for us guys, especially. I don't know what it is. The women seem to do it a little better, but it's really difficult for me. Man, Yolanda, look at you. Holy cow. You were a frog in another life. So lean your hips back just a little bit. You'll feel a little stretch in the groin. Yeah. Now, the other thing you can do is this. I want you to raise the foot up the best you can, and then back down. So one foot, I want you to raise up gently. Some of you don't have much internal rotation of the hip, I can see. 0. Come out of your stretch just a little bit, and now lift. There you go. Try to lift that foot out to the side. Hold it for a count of maybe 3 seconds, and then let it back down. Do 5 on each side. Lift. That pulls that hip into internal rotation. Lift. Good. After you do 5 on the right, do 5 on the left. You might notice that you can't do it on one side compared to the other. A lot of people are very asymmetrical when it comes to rotations of their hip. Usually you'll be really limited on one side and a little more flexible on the other.
The worst part about this is the floor.
Yeah, the floor is pretty hard.
We need some soft.
You need some nice soft yoga mats. Yeah. So everybody got 5 of those in? Good, how we feeling, all right? Next one. Everybody kind of get in a quadruped position just like this. Your legs gonna go up just like you're doing a donkey kick, just like this. Then you're gonna take a nice big circle and bring it back down. 5 of these, straight up, rotate and come back down. Do not move the back. So when I go to here and I'm rotating my hip, my back is rotating, do not do that. Back should stay flat. In other words, if I put this across my back like so, it should not lift. I'm here, I'm rotating out and back underneath me without rotating your back. Let's do 5 on each side. So donkey kick up, out like you're doing a hydrant, fire hydrant, and then bring it back down into the underneath you. 5 good ones. 1, 2. Some of you might feel your hip popping. We've got kind of a rope band stretch for that. So 5 on the right, same thing with the left. Up, open, back down. Try not to move the back. Keep the back flat as you do this.
Feel that.
Ooh. Last one. 5. Good. Okay. Let's grab a rope band. I think we can 1, 2, 3, 4, 5, 6, 7, 8, 9. For the most part. Yeah, there's one. Everybody grab a rig, so just a pole and a green band. And I'll kind of demonstrate right here. You guys can kind of just, I'll show you how to do 2 or 3 different ones, and then I can have you try these on your own, okay? So everybody kind of loop it around the bar. Perfect. Awesome.
Yeah, you're good there.
Awesome. Okay, first one. Hip flexors. Remember we talked about that? So anytime you're doing these, we're using those. Or burpees, right? Right from here to there. Using those hip flexors. Boom. You got to be really quick. That's where you're going to hit them. So you're going to put in, I'm stretching my left one. You're going to put it in this gluteal fold, is what they call it. So that band goes here. You drop that same side down onto your knee. You get some tension on the band. It'll go on that other one. If this is the one down on the floor, then that's the one that'll go. Yeah.
Okay, so whichever one is longer.
So once you get to this point, let the band drag you forward a little bit. Okay. Now you're going to squeeze your glute, and when you squeeze your glute, you're going to feel the front of your hip go. Ooh, I can feel that stretch. So squeeze that glute. And you're going to take your arm up over your head, and you're going to bend so if it's your left leg that's down, your left arm is going to bend to the midline. Does that make sense? I'll make sure you guys are doing it right. So if the left one is down, yep, that's how you're doing. Good. Perfect. So you got it there. Raise up. Make sure that glute is, squeeze that glute, and then bend sideways. You're going to feel this stretching right in here. Okay? So you got, there you go. There you go. Good. Nope, the other one. The one that's down is, yep, perfect.
Okay.
Squeeze that glute, and so when you do that, you're going to feel that stretching here. As soon as you squeeze that glute, you can feel the burn in the front of the hip. Feel that?
Yeah.
There you go. Perfect. Just feel that right in there. So that's the hip flexor stretch. You come in and you're really tight in the front. This is the stretch you want to do. How do you guys got it? Pretty good over here? I would bring that just up a little bit higher, up into your body. Maybe right, yes, perfect, right there. Now drop it, yes. Yep, you got it. Up, and let it drag you forward a little bit, then squeeze your butt, and then lean just upside until you feel it stretch. Perfect.
Oh, probably.
Feeling the bigger stretch there? Yeah, good. Awesome. All right, So that's a hip flexor stretch. Everybody did both sides? No? Everybody flip sides then, try it on the other side. You might find one side is way more looser than the other, right? The muscle we're stretching is called the psoas. The psoas muscle, you've probably heard of it before. It starts on the inside of the groin. It goes up through the pelvis and it attaches to the front of the back. Yeah, that's why you're feeling such a stretch there, and you might even feel it pull your back out a little bit. That's why you squeeze your glutes, and once you fire the glutes, it'll inhibit the flexors to activate, and so then you start feeling it more in the front. Good. Give you guys just a few more seconds. So I like that one a lot, especially after doing a lot of what? Toes to bar, burpees, box jumps, anything where you're closing down the knee to the chest. Anything you're doing quickly this way, those psoases are really lit. Or a lot of ab work, we'll also use those. Toes to bar, knees to bar, anything where you're closing down, right? Slam balls. Okay, so then the next couple that I want to go over is, one's called a crossover stretch. You're going to put it right in that hip, back up just a little bit, cross your leg, grab the knee that is bent and take it to the opposite shoulder. So you're just going to grab it and you're going to pull it. This is pulling the hip out, so it's giving a little traction. It's opening the joint while you're stretching. You're going to feel that right in the back fanny, a muscle called the piriformis, okay? That one's a really good one. Okay, so let's try that one. There you go. Bring both knees up. Yep. Cross this one over. Just like that. Let that go a little deeper into the hip joint. Perfect. Now, take that hip, or that knee, and take it to the opposite shoulder. So grab it with both hands. Both hands. Gently just pull towards your, yeah. Feel that burning right in here? Good. Feel that in the fanny?
Shayne, I have a question.
Yeah.
So if people are feeling like out of breath when they're in a stretch.
Yeah, they're holding their breath.
Yeah.
Yeah, you need to try to relax the best you can and breathe out.
It shouldn't be like, oh my gosh, I don't think I can do this much longer.
Yeah, a lot of people strain or they really
I tense up.
I do too.
So
You tense up. Remember to relax. This should be a relaxing effort, not so
This isn't
difficult.
a
Right, this isn't that exactly. It's not that hard. It should be relaxing. Perfect, Andrew. Feel that? As you cross that over even more, you feel it. Now you're doing a figure four stretch. That's my next one. You must have some kind of intuition already. The one that I was going to have you do right now, grab that knee. Towards the opposite shoulder. Yes. But I like the figure four. We're going to do the figure four next. Okay, everybody kind of worked on the crossover stretch. Now, yeah, you're doing the figure. Well, you can. I'll show you real quick because some of you are kind of modifying it. The crossover stretch is the one that I just showed you, where you take the knee over to the opposite shoulder, crossing it over. The figure four is you're opening the knee and you're grabbing the thigh here and pulling that towards yourself. As you can see, I don't have a great figure four. Right here is about as far, I can lift it off the ground. That's about it. So some of you have a much better figure four. So here's a figure four like this. Grab this side, here and here. Yes, perfect. So, yeah, awesome. Now you're getting the traction of the band.
Don't worry,
and at the
Alexis, I'll
same
get you.
time,
She has been.
Just
you're
kidding.
Go
stretching.
back in there and
So yeah, that's a big crossover, and then the figure four was just like you did before. Yes. So that's nice on the crossover. Have you tried the figure four? Yeah, just like that, and then reach through your leg. That's awesome. That's the figure four. So I like both of those, crossover and figure four. You got a few different hip muscles. One's the piriformis, which is good for the crossover, but the figure four one is good for obturator and gemellus. There's two other groups of muscles in the butt that do some rotation, and you're kind of picking those up.
like this, right? Shayne.
What's that? Yeah, that's good. Perfect. Oh, yeah, you got it. Yeah, perfect. I like it. Yeah. Good. So, the next one real quick. Well, tell me when you guys have done a little bit on both sides. I want you to do it on both.
Everyone else in it too.
Once you do it on both, then I have one more, well, one or two more with the band. But again, like Chris said, this is after activity. You're cooling down. You're just relaxing, but you're giving that muscle a nice stretch. So the next one is hamstrings. Same thing. You're gonna put it right in the crevice. Give yourself some tension. Grab onto the leg and slowly pull it back. Now you're getting a hamstring stretch. At the same time, it's being pulled away, so you're getting some traction of the hip. And then you're stretching hamstrings, right? So just laying down, keep the leg out in front. Let the hip you have to relax and let the joint open up. The joint will only open up if you relax and let it. And the band will just pull it. So you have to have enough resistance on the band so that it pulls it out of the joint, and then you just really feel a good muscular stretch.
This is where all my problems come
Hammies?
from. Yeah.
So, any questions so far?
Is it good to hold this like as a static hold for a while, or is it?
Yeah. I mean, I think 30 seconds would be great. If you can do 30 seconds, 3 of them on each side, that's a good hold. Longer the better though. Like if you really feel a restriction in one of these and you're like, I really need to improve, you actually need to work up to 2-minute holds.
Wow.
Yeah, I know. It seems like it's crazy, but all the research shows the longer the better. You're going to get a change in length if you hold it longer rather than just a short moment in time. 2 minutes seems like it's forever. So maybe your intensity needs to drop a little in order to go longer. So think about that too. If you're just holding on and you're like, I can't do it this heavy, then you need to back out of it a little bit and just hold it longer.
Hey, Shayne.
So much of what we do in the before, you know?
Doesn't like that one.
It feels like it's coming out of socket.
Out of socket?
It's just weird. It's like a pain.
Can't
Pinch
overpower
in the front.
Right?
that mobility in the hamstrings.
This and that
So then
like
I
that.
ground my back.
Maybe I shouldn't use the whole foot.
That's where it tweaks my back. I'm not sure. It has to be really
Right there. Bend the knee. Bend the knee. So bending it's going to be okay, but when you lengthen it, that's when it really goes. Yeah.
Yeah.
I just keep it bent.
Yeah. You got all
And
disconnected.
it's
So it's
like
like
that.
The left or the right one is fine.
Yeah.
when my hamstrings, when my hips are definitely.
Okay, doing good there? There's one other one that I kind of like using, well, there's a couple other ones that I like using the band. One is if you have some clicking and popping in your hip and you want to do a little traction with a little movement, then put it under one of your hips. When you get in kind of your hands in each position, you're going to feel this just pulling the hip kind of out of joint a little bit. You're going to come down onto kind of your heels, and then you're going to raise back up, and you're just going to kind of do some of these here. And this way, the knee or the hip is actually getting some traction. It's being pulled out of the joint while you're moving it, and it'll kind of open that capsule a little bit, and let some fluid in and out of it, and stretch the capsule a little. Feels pretty good. Some of you that if you have a lot of hip popping, snapping issues like that, that can work pretty good. It's a little traction on the hip. Just grabbing the band, pulling it laterally while you're going into a little bit of flexion extension. So here, back up, here, and back up. And you might feel like that loosens things up pretty good. You can try that if you'd like. So take a 90-degree angle at it. Let it pull you. Face that way. Yeah, perfect. That's good right there. And then just sit back on your bottom and then come forward. Yep, just like that. Now when you come up, you should feel the hip kind of open up as you come up. And then it closes as you bend down over there. And you don't feel it much until you get up and you start moving around and you're like, woo, that feels good. So it's one of those that you don't feel really the burn or you don't feel like it's doing much, but it is.
After these seminars, it's like,
oh, I know. This feels so good. Yeah. Awesome. Just back and forth maybe 8 to 10 times, and then flip it and do it on the other side. Does that feel okay on that hip?
Yeah.
Good. So as you can see, a lot of things you can do with the rope band. Everybody feeling a little looser?
Maybe you should just come to this every Saturday.
What's that?
Maybe
I know,
you should
right?
Just come to this every
That's so
Saturday.
good. Just kind of lead you in going through each of these little stretches.
I'll send this video to all the coaches so they
There you
can
go.
work it in.
Work it in.
15 seconds, so we have.
Yeah, the 15 seconds between classes.
Yeah.
You can always stay after.
15 seconds.
Yeah, you can always stay after and do this stuff. It does, yeah. Some of them. I'm working on it. Trying to figure that out.
Okay, let's go over the lateral hip muscles real quick. So we talked about the lateral hip muscles, right? The ones that just help us go sideways, helps us run, help us stand, do step-ups. Those muscles come from the side of the hips. A couple of little warm-up exercises that I like to do to kind of warm these muscles up a little bit. One is doing some side planks. So holding a side plank and then doing little kicks to kind of warm up that. You'll feel it warming this one, but this one's stabilizing at the same time, right? Flip over, same thing. Opening, holding that side plank, and doing about 10 to 15 of those to kind of warm up those glute mediuses a little bit. That feels really good. Why don't we try a few of those? We don't work our lateral hip muscles enough. Come up into that side plank, but do it off of your knee. So bend both knees. Yep, both knees. And lift your hips up. Now do it. 1, 2, 3. Good. Perfect. Hold that plank all the way through. Hold that plank all the way through 10 of them. And then switch to the other side. If you can't do 10, those lateral hips are pretty weak. You go for a run, and I'm telling you, you're going to feel it. So, strengthening those glute mediuses a little bit in this fashion are really going to help. Little burn. Now, you can add like a band around your knees if you think that's too easy. Or you can do side planks without on your knees, right? And just do kicks to the side with a side plank. So either side plank here or side plank here with a straight, longer lever system, right? Rather than doing it on your knees, but also working the sides of your obliques as well as the glute medius. Okay? Awesome. So, what do we do to stretch this area here? It's called a crossover stretch on the wall. So everybody get on the wall. Let me demonstrate first. The leg that you have closest to the wall, you're going to cross over. Then you're going to lean your hips towards the wall like so. Keep your elbow on the wall and let the hip lean inward until you feel a stretch across the side of your hip. Okay, so elbow on the wall. You are going to keep this one straight. So, and you're going to go over it with that one. You have to come out a little further, maybe a little further. There you go. Cross, let the hip lean in. Put this leg like here. Yep, this all stays straight and let that hip lean in. You're not going to feel a burn like you do a hamstring, but it's going to feel like a real nice stretch on the side of your hip. Okay? It's stretching glute medius, it's stretching TFL, tensor fasciae lata, both muscles that kind of attach. TFL in the front of the hip, glute med in the back of the hip, both get a good stretch with this exercise. No one uses this stretch at all, and it's such a great stretch, okay? Especially when you're done running, or stair climbing, or step-ups, or lunges. And then let your hip kind of lean in. Perfect.
Symmetry.
Good. I would bring that a little closer to the wall. Yeah, a little closer to that. Yep. And then let the hip lean. There you go. Yeah. You feel it up here or up? Yeah. Up a little further. Good. Yeah. Feeling that, Dylan?
Gotta get on this. Get in on this one. I need this. We are.
Good. Okay, that's the standing wall stretch. Great for the TFL, the IT band, the glute medius, all of those muscles on the lateral side of the hip. Okay, you make sure we did both sides, right? Okay. Okay, let's go to the back real quick and do a few things. First one. We're going to use these boxes. And a lacrosse ball. Are they in that?
Yeah, I'll get them for you.
Okay. So I'll grab the lacrosse ball that I brought. This is what we're going to do. You're going to find a height of a box that allows you to lay on, but also allows a little bit of gap down here. See this gap? My hips are going to rotate and they're just going to sag, and I'm opening up those lower joints and causing some traction. Then I'm taking my lacrosse ball and I'm putting it right down in one of those sore spots in my back, and I'm just rocking back and forth. Feels so good. So you're just kind of relaxed, your knees are up, your hips are rotated, your hips are sagging, and you're just rocking back and forth on the lacrosse ball. Put the lacrosse ball in the areas where it's tender or where it's hurting, and then if you want to, and you find a real good hot spot, hold it right there and sag and let the body melt into the lacrosse ball for a moment, and then go hunt around and find another sore spot. Okay? So we probably ought to grab lacrosse balls and boxes. A couple boxes. Two people can probably use the same box, right?
Okay.
So here's the lacrosse ball. Everyone grab one. There you go. The height only matters because you want the hips to be off of the ground slightly.
Thank you.
So your leg length has to be about the same if you're going to use the same box, right?
Yeah, that's perfect.
I know, it's like shorter. For me, that size looks perfect, but you guys might need a little bit higher. Try it. You might need a little bit.
I can try.
This one's good for you.
That's,
Well, you got a ball.
it's all good.
All right, so feet up on the boxes. If the hips are sagging a little bit, you're perfect. You have a ball. Grab that ball, put it back there, right where it's kind of, you put it right in this, kind of right next to the spine. You can move it around, find some hot spots. let your hips just kind of rest there. You can also oscillate back and forth a little bit, or you can just sit on it. You know what I mean? Like just let the pressure build.
I'm just gonna be here all day.
What's
I'm
that?
just gonna be here all day.
No.
I know, right? Just rock back and forth. Do you find
Yeah, apparently I don't have the proper height for this.
Do you need to be a little higher, you think?
Yeah.
Yeah, so just flip it.
But that was way
What's too high? Well,
It's alright.
try the smaller one.
I'll get
At least
that.
this way.
You think some
No, I think
25?
that's probably right there. That's good.
Ground.
Is it?
Yeah.
Yeah, it is. It's okay. Yeah, you're right in
Should I
between.
grab
Okay. She's right in
10s or
between.
25s?
What's that?
Maybe like the 10s or 25s.
Maybe.
That's good.
Yeah, it still feels good because the legs are up and you got a little pressure on it, right? That's what I want. I want a little bit of pressure on the ball. How's that feel?
Good.
Feel all right? Good. It's a good way to mobilize out, especially if you have local trigger points, hot spots in that lumbar spine. If not, the foam roller does a pretty good job of kind of hitting it broadly, but the ball is so much better at finding just those local little small spots that are tense, tight, flared up, sore, trigger points. And again, you want to find the meat of the muscle right off the spine. You can also get down in the SI joint, right kind of where those dimples are down in your pelvis. You can also rub down in there. Some of you are really bony, and maybe that doesn't feel good, so you have to find some soft tissue to put it in, right?
However, try and do both. I'll help too. I'm gonna share a box with you.
There you go. Find a spot.
What I need.
There you go. Perfect.
There it is.
I hear nothing, no complaints. I don't hear like anybody. I mean, it's just
That
like
means they're breathing good.
everybody's just in their happy zone right now. I love it.
You mean it's not supposed to hurt?
I mean, yeah, I usually try to find a sore spot and then it kind of hurts a little bit
Yeah.
for a moment.
Mhm.
Yeah. But sometimes you're just rubbing out tense muscles, tense tissue that just needs to be mobilized, rejuvenated. The pressure releases tension. The muscle fibers have little apparatuses, little spindles inside the fibers that react to pressure and tension. So when you stretch or when you put pressure on them, the muscle releases, it relaxes, it resets, if you will. Golgi tendon apparatus, have you ever heard of that? The GTOs?
Nope.
No. Muscle spindles. Andrew remembers them.
Oh, yeah.
Was that in the master's program?
That's the master's program.
Yeah. That's just anatomy, too.
It's just anatomy. Exactly. Awesome. Okay. When you're all done, we got one more use for the ball. This one works really good. You're going to find a wall, and you're going to put that right in your sciatic notch. Does everybody know where their sciatic notch is? In the side of their butt. So if everybody's kind of looking, where that ball is right in that soft spot in that side of the hip, find a wall and put it right in that soft spot and then start oscillating. It looks a little funky, but you're just going to put it right there and you're going to go hunt around and find all the little trigger points.
Yeah, all of them.
Do you feel them? That's all you got to do is just lean into that wall. That's perfect. You want it good. And just push it. I would say more like stitches. Right in there. Yeah. Ow means you hit the right spot. So 3 to 5 minutes of this.
What?
On the left, 3 minutes on the right. This one should be done like daily, especially with all the glute activity that you guys do, back squats, front squats, box jumps, burpees, all that stuff is just lighting up that glute. And the glutes, when they tighten, pulls on the back. All those muscles, they come and they wrap right into the base of the low back. So if you can release all this tissue down here, the back's gonna feel so much more free, feel so much better. Get those pretty good. Finding some hot spots in the butt. Yeah. My daughter does a lot of women's health and a lot of pelvic floor disorders and urinary incontinence, all kinds of stuff, and using her elbows on their butt every day, releasing tissue, and it works magical. So everyone can benefit from it, that's for sure. I like these lacrosse balls that are the real ones that are rubber, because on the wall they stick real good and they don't flip out very often.
I don't have too much fun with this.
So if you don't have your own lacrosse ball, you should get one, because at home they work great.
Yeah, we keep them in our cars.
Thank you.
Right, in your gym bag, just take them with you.
Yeah.
Yeah.
I think I'll be
I mean, nowadays you can buy these that are like massagers, they vibrate, they move up, and you can put them everywhere and they really feel good.
Works great for your feet too. You can,
Oh yeah, it's pretty good.
for your heels. Another trick that I've learned is
They,
you get it to grab your skin and kind of turn it on your feet. Find like the tight spots in the heels. And
Yeah, it works really great for plantar fascia.
Yeah.
Yeah.
rolling out the bottom of
Rolling at the bottom of your feet, especially after runs and a lot of jumping activities, bounding, running, hopping, skipping, jumping, all that kind of stuff. You come home and rub those underneath your feet. It's so good.
I keep one under
so
my
like
desk.
telling my sisters so last night, they're like, what do you think about this day? I'm like, those for all shoes.
Okay. Everybody get like 3 minutes on each side, or at least a couple minutes on each side.
Oh yeah, they're not cheap. For sure. Can we just skip some?
Okay, while you guys are rubbing out,
Okay.
so the last one I want to kind of go over is some self-mobilization on the psoas. We talked about the psoas here in the front and using the bands to stretch out the psoas, but also you can get to the psoas by going through the side of your pelvis and then moving your leg up and down using the kettlebell. So what you do is reverse, or to put the kettlebell upside down, find the bony prominence in the hip, lower the kettlebell horn into your pelvis, like so, and then you're just going to extend and flex that leg. And you'll do it about 10 times on the right, 10 times on the left. And that helps release and floss that muscle that runs from the inside of your hip right through your pelvis and to the back of your front of your spine. And by putting pressure on it and having you do some contract relax techniques on it, it'll help floss out and massage that muscle and release some of the tension in it. And it feels so good after you're done. So when everybody's done, grab a light kettlebell
Are we done with
and try these psoas releases. We're done with the lacrosse balls. Good. So a light kettlebell, everybody supine or on their back. Find the little bone that sticks out on the sides of your hips and drop the kettlebell down inside right on the inside of that bone. So, and I'll kind of walk around and make sure you're doing it right. So you got a light kettlebell, you're going to flip it upside down. Put the other knee up, so the other knee's up. find that bone, right to the inside of that bone, just let it sink in. Now you're going to flex and extend that leg. Run it right next to the ground. The heel should be running right next to the ground. There you go. Perfect, just like that. Good. Back and forth. Let that heel run right next to the ground. So bend the knee and just slide here and slide back out. Yeah, there you go. Lift it. So that leg should just slide out almost on the heel, out and back. And do 10 of those. Good. Right there, right? So there's the bone. Yeah, look at this way. All the way deep into the head. Big one.
Yeah.
Perfect. Yep. Everybody's got it. 10 times on the right, 10 times on the left. That's good. I'm going to have you bend this knee, and here's the bone. I'm going to have you go right inside there. Sorry.
Yeah, no, you're
Right
fine.
there. That's perfect. Right there. And then back and forth. And that might be a little.
You might get some grimaces on this one.
Good. Right there. Yeah. 10 of those on the right, 10 on the left. Good job. How those feel? Here's a little heavy. This is a little lighter. Is it painful? Or just too heavy to hold? Yeah. So find that hip muscle right there. And then you go right deep into there. Oh yeah. And when you press on it, you'll feel it kind of, and then, so when you go to extend your leg, you should almost feel the kettlebell raise up a little bit because it's being activated. And then as you release it and reach out, then it lowers. So you can kind of feel it actually contract and relax. And this is a flossing technique. So if you think of like flossing your teeth, right? You jam the flossing the floss up there, and then the teeth stays still while you move it back and forth across there. You're keeping pressure right on that muscle while your leg is causing it to floss underneath the kettlebell horn, right? So this is just a flossing technique that helps release some of that tension in the pelvis due to the psoas. Okay.
Yeah, well, this will help us. We're gonna be feeling good. Gonna have you back squats Monday.
Oh,
It's been a little while.
it's been a while since you've done load week.
Yeah.
You've been deep, yeah.
So we're in the open and then deload.
Yeah. I took the course I did too.
Good. Everybody feeling good? So, if you are completely warmed up, your hips feel good, you can try this fun little game if you want to try it. You grab a mobility stick, you have to balance it, go all the way down to your back and back up while balancing it. Slowly, if your hips are mobile enough, you can balance and slowly work your way down. All the way down to...
Yeah.
Oh! Wasn't able to catch it. But you should be able to keep it balanced and then work your way all the way back up. If you can slowly work your way up and down using your hip mobility. That's kind of fun. The other fun partner exercise is bringing, let's have the one corner here. Put that right in kind of, yep, just like that. And slowly with a partner, work your way down to the ground and back up without using your hands. So slowly just work your way in without dropping the pole. Yeah, just gotta keep coming all the way down.
That's awesome.
Good. Now what are you gonna do?
Yeah, what do you want to do?
Come this way towards me and keep coming. Yes, keep coming. But I don't know if I would be able to get up from here.
Yeah.
you'd have to.
Stretch out those
Yeah, I've seen people do it. It's pretty tricky, but you can try it with a partner if you want to. But the balance one's kind of fun, and then of course this one with a partner, you can work on at home if you want, or if you want to just knock you around a little bit, you can do that too. But getting down and back up shows that you've got a lot of good hip mobility without using your hands to be able to go all the way to the ground and back up. So it's kind of fun. Cool. And that's about it. Anybody have any questions?
We want to try it.
Awesome. How do the hips and the back feel? Pretty good. We got the psoas stretched out, we got the paraspinals, we got the ball on the glutes, we got the IT band, a lot of hip range of motion and stuff, so I think we hit it all. It's good.
Awesome. Thanks, Shayne.
You bet.
Thanks for being here.